Hello, my name is Lachelle, and I'll be your admission nurse today, and I'll get you orientated to the unit after this. What is your first and last name?
Lauren Agnew,
All right, Lauren. And what is your date of birth?
June 16, 1996.
All right. And Miss Lauren, what brings you in today?
My mom suggested I come in. I've been feeling kind of depressed lately, between stress from working at home and being a single mom. I haven't really been feeling myself lately.
Okay.
I've been having like suicidal thoughts.
All right, I'm sorry to hear that. I know depression can be a really tough thing to tackle, but we're here to help you, get some coping skills and then just get you back to your everyday life one step at a time. How does that sound?
That would be great.
Perfect. Is it okay that we go over a little bit of your health history?
Yeah.
All right, awesome. And Miss Lauren, when was the last time that you felt well, like not so depressed or, so many stressors coming at you at one time?
I don't know, maybe a year ago.
Okay. Any thoughts of suicide? I know you said you were really depressed, but any thoughts of suicide or hurting anyone else?
Yeah, sometimes I think about suicide.
All right. Do you have a plan or any intent on going through with the suicidal attempt?
I haven't really made a solid plan yet.
Okay. And just a little bit about your past psychiatric history. Any admissions to any previous psychiatric units?
No.
Okay. Any past suicidal attempts?
Yeah, once when I was 16.
Okay. Anything that triggered that suicidal attempt for you that you can remember?
I think that was when my dad left the house.
Okay.
Just me and my siblings and my mom.
All right. Any past trauma, like sexual assault, physical assault, mental abuse?
No.
Okay. And then just going over a little bit of your medication. Do you take any medications that were prescribed to you by your regular doctor, or do you take anything over the counter like vitamins or supplements?
I take Tylenol every once in a while.
Okay. Any past medical history? Any history of seizures?
No.
Okay. I know you said you have children. Did you say 3, if I'm not mistaken?
Yeah, I have 3 children.
Okay. And did you have only those 3 pregnancies, or have you had multiple pregnancies?
I had a miscarriage.
Okay.
Right after my first was born.
Gotcha. And do you get your periods regularly?
They're not regular. They come.
And when was the first day of your last period?
It ended last month, like the 15th.
Okay. Any known allergies to food or medications?
No.
All right. Any weight gain or loss of weight within the last month that you didn't intend on doing?
Yeah, I lost some weight.
About how much?
Like 15, 20 pounds.
Okay. Do you feel like that's because you're eating poorly, or your appetite just hasn't been there, or?
I haven't really been eating. I haven't felt like eating. This depression's really been kicking my butt.
Any excessive tiredness or trouble falling asleep?
No.
Any fevers or night sweats?
No.
Okay. Any blurred vision, double vision, or loss of vision?
No.
Any flashing lights at all?
No.
Okay. Any runny nose, sore throat, feeling feverish, sick?
I was sick like last week.
Okay.
I haven't really been coughing or anything since then.
So no symptoms as of right now?
Mm-hmm.
Okay, perfect. Any chest pain,
No.
palpitations?
No.
Shortness of breath?
No.
Okay. Any wheezing or persistent coughs? I know you said you had a little cough last week, but is the cough consistent from last week at all?
No, I feel better.
Okay. And then just to go into like everyday living, like things that you do for yourself, such as bathing, toileting, cooking for yourself, getting dressed. walking around your house or even just going to the store or anything like that? Do you have any limitations physically that can keep you from doing that yourself?
No, I wouldn't say so.
Okay. And you're able to walk up and down the stairs by yourself without any medical devices?
Yeah.
All right, perfect. And then just a little bit about your family history. I know you said your dad left when you were younger, but mom's still in your life. Do you know if mom has any past medical histories like cancers, diabetes, hypertension, or anything of that nature?
She has high blood pressure.
Okay.
She takes medicine for it. She gets like swelling in her ankles sometimes, and I have to wrap them for her.
Okay.
I wouldn't know anything else.
Gotcha.
We try to keep it high and dry.
Gotcha. What is your current living status? Are you homeless, on the street, in a shelter, group home? Do you own your home or rent?
I rent an apartment.
And your 3 children, they stay with you as well?
Yeah, my mom lives there too.
Okay. And when it comes to your employment and income sources, are you currently working full-time, part-time?
I have 2 full-time jobs, and I have a part-time job. But I go like every other weekend, twice a month.
Busy lady you are then, I take it?
Yeah, I have to stay on top of these bills.
Gotcha. Any history of being in the military at all?
No.
Your family?
Not that I know of.
Okay. Do you know if mom or dad have had any past psychiatric history, like any mental health disorders?
I don't know. I couldn't tell you.
Gotcha. And then, are you able to tell me who the current president is?
Donald Trump.
All right. And do you know where you are?
At the hospital.
Yes. All right. And if you had to describe your mood to me today, what would you say your mood is?
Happy.
Happy? Anything that gets you excited?
Not as of lately.
Okay. And Miss Lauren, do you feel like you have any issues concentrating on things? Like if you're reading a book, your mind starts to wander and just go off into thinking something? Okay. And what is your highest level of education?
I graduated high school.
Okay. All right, and just to reel it all back in, any current thoughts of suicide?
Like I said, sometimes.
In this moment right now, have you had any thoughts of suicide?
Not speaking to you.
Okay. Any thoughts of hurting anyone else?
I've thought about hitting my kids or something when they make me mad, or I come in and the house is messed up, or after working all 3 jobs and I'm just super wore out. But I understand it's not their fault.
That's good. Any hallucinations, seeing anything or hearing anything that's not there? All right. Any previous substance abuse, drugs, alcohol?
No.
All right. All right, perfect. So that's all I have for you. Did you have any questions for me at all before I get orientated to the unit?
Do I have to pay for this?
I believe that the insurance takes care of that, and then that's something that you can discuss with the social worker.
How long would I have to stay?
Typically, people stay here for roughly 4 to 7 days, just depending on the treatment and how you're participating in your treatment. If you're getting out of it what you feel you need to get out of it. If you feel like you need to go home earlier, that's also an option. That's something you can do either with the doctor's, permission or against his orders as well.
Will my kids be able to come?
We do have visitation hours between 6 and 8, and then on the weekends it's a little bit more free to come and visit. But as you know, your main focus here is to get better, get more stable, and focus on yourself.
All right. Thank you.
You're welcome.